Interesting TCM and acupuncture. Tongue diagnosis of TCM. The body of the tongue is composed of muscles and vessels. In ancient times, some people believed that the surface of the tongue corresponded to the viscera. That is to say, the tip of the tongue reflects the pathological changes of the spleen and stomach. The root of the tongue is a kidney. The margins of the tongue reflect the pathological changes of the liver and gallbladder. Such an idea about the correspondence of the tongue and viscera is clinically practical. However, the analysis should be comprehensive and based on the changes of the tongue body and tongue fur. Inspection of the body of the tongue includes the color, shape, texture, and movement of the tongue, which reflect the conditions of the viscera, qi, and blood. Tongue fur or coating refers to the lichen-like material formed on the surface of the tongue. Inspection of the color of the pathogenic factors, as well as the interaction between healthy qi and pathogenic factors. The conditions of the tongue among healthy people are the normal states of the tongue marked by suitable size, softness, flexibility, light red color, luster, and moisture. Even whitish thin fur, which is neither dry nor greasy and slippery, closely attached to the surface of the tongue, distributed more on the center and root and less on the margins and tips. Normal conditions of the tongue is usually described as light reddish tongue with thin and whitish fur. Suggested normal functions of the viscera, sufficiency of qi, blood, and body fluid, as well as the abundance of gastric qi. Light red color, lustrous and moist, mobile, flourishing tongue shows spirit. If there is disease, it's still in good shape. The body of the tongue is in close relation with the visceral qi and blood through the meridians. By means of inspection, one can understand the conditions of the viscera, qi, and blood. Inspection of the body of the tongue includes the color, shape, and movement of the tongue. Color of the tongue, shape of the tongue, movement of the tongue, sublingual vein. 1. Color of the tongue. Generally light reddish in color, light whitish in color, red, deep red color, cyanotic, and purplish color are the colors of the tongue. Shape of the tongue includes rough tongue, tender tongue, bulging tongue, thin tongue, fissured tongue, prickly tongue, tooth-marked tongue. Prickly tongue. Prompted by hyperactivity of heat, fire, or blood pathogenic heat. Movement of the tongue. Normally the tongue is soft and flexible. Pathological tongue is flaccid tongue, stiff tongue, deviated tongue, shivering tongue, protruding and wagging tongue, and shrunk tongue. Sublingual vein. Inspection of tongue fur. Nature of tongue fur. Nature of tongue fur color. Thickness. The standard for examining the thickness of the tongue is whether it is bottom visible or bottom invisible. The thickness of the tongue fur reflects the degree and severity of the pathogenic factors as well as the development of disease. Thin fur. Thin fur can be seen on the tongue surface, indicating nourishment of stomach qi and reflecting the degree of severity of the pathogenic factors. Pathogenic factors are due to internal impairment with deficiency of healthy qi. Thickness, thick coating. Thick coating indicates phlegm and dampness, food stagnation, and internal heat. Moistness and dryness of tongue fur. The moistness and dryness of tongue fur reflect the conditions and distribution of body fluid. The tongue fur that is moist with moderate dampness is called moist tongue fur. Seen in normal tongue, wind-cold syndrome, dampness, food, and blood stagnation. Moistening of the tongue fur. Moist tongue fur indicates efficiency and upward distribution, phlegm syndrome, and dampness. Dry tongue fur. Dry tongue fur indicates consumption of fluid by exuberant heat. Hyperexia, sweating, the decline and development of yang qi, and turbid dampness. Rough tongue fur. Rough and sandy, indicates consumption of fluid by exuberant heat. The greasiness and putridity of tongue fur, indication of phlegm, damp, and food stagnation. Greasy tongue fur. Tongue fur compact and difficult to exfoliate, which is thick on the center and thin on the margins. Putrid tongue fur. Tongue fur compact and difficult to exfoliate, which is thick on the center and thin on the margins. Exfoliating tongue fur. Exfoliation of the tongue fur is usually due to the failure of gastric qi to nourish the tongue due to qi deficiency or due to the failure of the exhausted gastric yin to moisten the tongue or blood and qi deficiency or weakness of the body. Medium exfoliated tongue fur. Middle of the tongue fur is exfoliated. Root of tongue fur exfoliated. Patched exfoliated tongue fur. Some parts of the tongue fur are exfoliated. Mirror-like tongue. The tongue fur is completely exfoliated. The tongue fur with root. The tongue fur with root means that the fur is closely attached to the surface of the tongue and not easy to exfoliate. Tongue fur without root. The tongue fur appears floating or painted on the tongue and is easy to exfoliate. The color of tongue fur. The color of tongue fur commonly seen are white, yellow, and grayish black, which may appear singularly or simultaneously. White tongue fur. Different from normal tongue fur. White tongue fur is usually seen in external syndromes and cold syndromes. It's not only confined to external syndrome and cold syndromes. Whitish greasy tongue fur. Powder-like, thick and white tongue fur that does not feel dry. Yellow tongue fur. Yellow tongue fur usually indicates internal syndrome and heat syndrome. Light yellow tongue fur. During the course of a disease, the change of tongue fur from white to yellow. Deep yellow tongue. Yellow fur added gray and black fur. Yellow greasy tongue fur. Indicates damp heat due to phlegm or fluid retention transforming into heat, or due to food retention and heat putrefaction. Grayish black tongue fur. Grayish black tongue fur suggests severity of internal heat syndrome or internal cold syndrome. COVID-19 fighting illness disease classifications. 1. Differentiating pathogenic qi. The tongue base is light purple, the coat is white and greasy. This is a cold damp differentiation. The tongue fur is red, the coat is yellow, thick, and greasy. This is damp heat differentiation. The tongue base is red, the coat is yellow and greasy. The tongue root is dry. This is damp heat transforming to dry. Differentiating cold and heat. Cold and heat differentiation is best understood through tongue diagnosis. The coat is the main point to observe. If the coat is light in color, the illness has a cold characteristic. If the coat is red, the illness has heat characteristics. Differentiating severity of pathogenic qi. Pathogenic qi can be differentiated as either mild or severe relative to the thickness of the tongue coat. If the tongue coat is thin, the pathogen is relatively mild. If the coat is thick, the pathogen is relatively heavy. If the base of the tongue is light red and the coat is white and greasy with a thin coat, the pathogen is relatively light. If the tongue base is light purple and the coat is slightly yellow and a little dry, and the coat is thick, the pathogenic qi is relatively severe. Even though COVID-19 has both obvious and subtle elements, because the illness has severe pathogenic qi, it emerges quickly, so it's easy to cause severe heat issues which damage the fluids. This nature of injuring yin can easily be seen in tongue diagnosis and is an important part of the differentiation of syndrome. If the tongue coat is moist, the fluids have not yet been damaged. If the tongue coat is dry or spotty, the fluid is already injured. If the tongue body is light and the coat is white and a little dry, and there are some cracks and the center is white with a thick greasy coat, it may be differentiated as jin and ye fluids being damaged. If the tongue base is red and the coat is yellow, slightly thick and slightly dry, it may be diagnosed as jin and ye fluids being injured in a pronounced way. If the tongue base is red and purple with little saliva, the coat is scant and dry, then it's differentiated as pathogenic qi transforming heat and injuring yin. Differentiating illness stages. COVID-19 has various stages which may be differentiated according to the tongue diagnosis. We must follow various characteristic geographical elements in time. Patients exhibit symptoms which transform and can be understood as defensive qi, nutritive qi, and blood levels of the triple burner differentiation. At the first instance of transmission, defensive qi in the upper burner and taiyang differentiations. The second stage is at the qi level, middle burner, and shaoyang illness level, and yangming differentiations. Heavy and dangerous levels of illness are differentiated as nutritive level, lower burner level, and 3 yin meridian illness levels. On recovery, it's better to use organ and viscera analysis and view illness according to the lung and spleen chief acuity patterns. Early stage tongue image. The tongue base is pale and light red, the coat is white and greasy. Middle level tongue image. The tongue base is red, the coat is heavy, white, and greasy. Dangerous severe illness period. The tongue base is red with little saliva. The coat is lacking and dry. This is because heat has already attacked nutritive and blood levels, damaging yin, making it a heat pattern. Severe and dangerous level tongue image. Tongue base is light purple and dark. Tongue coat is white, heavy, dry, and patched. It shows that the spleen and kidney yang is injured. The pathogen has entered the nutritive and blood level and is a cold pattern. Recovery stage image. The tongue base is light, the coat is white, thin, and greasy, differentiated as lung and spleen Qi deficiency pattern. Observing the tongue can show us the emotional state of the patient. Observe the sides of the tongue to see if there is thin and small fluid covering it. This line is called a fluid line. The fluid line is frequently seen in liver Qi stagnation and phlegm damp patterns. Diagnosing the tongue with the fluid line is important to understand when patients are emotionally uncomfortable in clinic. It shows practitioners how to better select medicines and diagnoses changes in illness and whether they're severe or not. Wang Chanhui put forth the idea of liver Qi stagnation line, which refers to thin, greasy lines of saliva. When the tongue has this liver stagnation line, typically the patient's vitality will be nervous and tense. They will lose sleep, experience many dreams, and are easily woken in fright. Their pulse will be wiry, so in Chinese medicine, we typically refer to this as ganqi yujie, liver qi stagnation. Huan Huangmiao referred to this as summer line tongue, where the tongue base has a slight variation of indentations from teeth. The tongue coat is greasy and slippery and sticky. The sides have two lines and a little saliva coating, collecting that forms into a white line. It is also called half-summer line. Half-summer tongue has a half-summer base. This results from patients thinking too much, usually leading them to become nervous and experiencing many emotional changes. In most cases, medicines such as Weidan Tang, Banxia, Houbu Tang, and so on can be used. These two ways of discussing symptoms describe one problem. Wang Chanhui's liver stagnation line holds that liver qi stagnation can be treated by Chaihu decoction. White half-summer line is caused by phlegm damp and is treated with Banxia decoction. It can also be treated with Xiaobanxia and Fuling Tang, Wendan Tang, and Banxia, Houbu Tang, and so on. The above two concepts are actually one type of tongue presentation. Wang Chanhui's liver stagnation line is treated with Chaihu decoction to treat liver qi stagnation. Huan Huang's half-summer line treats phlegm damp with Banxia decoction. We believe that in clinic, when the tongue has a fluid line, typically the patient should be treated according to their emotional disturbance. We should dredge the liver and break up stagnation with Chaihu decoction or transform phlegm with Banxia decoction or similar herbal treatments. A diagnosis of emotions with tongue observation. Tongue diagnosis of fluid line happens on either side of the tongue. In this case, it's related to liver and gallbladder. It indicates heart vexation and easily becoming angered, being tense and having a sense of pressure. This leads to maladjustment of sleep schedule, so this fluid line is called the liver qi stagnation fluid line. It can also express as half-summer line in which the tongue and body is chubby and the coat is heavy and greasy. Patients often overthink, easily become tense, and experience significant fluctuations of emotions. Thus, it's seen in phlegm damp conditions. This fluid line can express with heart vexation, tenseness, annoyance, etc., and is related to emotional discomfort. Which medicines to use? In diagnosis of the fluid line, if the diagnosis is liver qi stagnation, it's best to use Chaihu decoction, and phlegm damp accumulation, it's best to use Banxia decoction. It is also possible to select extra herbs which assist in the emotions and relaxation, such as Huanhua, Yujin, Meiguihua, etc. It's also possible to use Sinisan, Xiao Chaihu Tang, Da Chaihu Tang, Chaihu Shugansan, Xiao Yao Wan, Chaihu Greyish Binjiang Tongue, Chaihu and Longu Muli Tang, Weigan Tang, Banxia Houbu Tang, Banxia Baimu Tian Ma Tang, Banxia Xie Xin Tang, and so on. Diagnosing emotions. When diagnosing fluid line, if the condition is mild, the line will be thin, as if there is recovery, it will disappear. If the illness is becoming heavier, the line will become heavier and much more obvious. If the patient is nervous and lacks sleep, it's called heart illness, still needs heart medicine to be treated. The emotions must be properly adjusted. At the same time, medicine must be used to help treat it. The patient should focus on relaxing and attempt to find strategies to be happier and in work and life. Then with proper treatment, they may obtain good results. Thanks for watching.